Hi everyone, I am Dr. Amodita Ahuja, consultant gynecologist and obstetrician from Akash Hospital, Mandyanawar. So today we'll be talking about when you should visit to the gynecologist when your pregnancy test comes positive. So it is very important that you visit the doctor as soon as the pregnancy test is positive. Why? Because first of all, the doctor will like to take a complete medical history of yours and a searchable history, that if you have any thyroid or sugar or BP or any other medical disorder, because that needs to be corrected. If you are taking any medicines from before, then those medicines need to be changed according to the medicines which are actually pregnancy friendly. The next thing is the doctor will start you on folic acid. Folic acid is nothing but it is a vitamin which belongs to B complex group, which should be started in the dosage of 5 milligram, and it should be taken actually from the day the pregnancy test comes out to be positive. What it does is, and why it is important to take folic acid, is because this folic acid will prevent the actual birth defects in the baby or the neural tube defects in the baby. Then the doctor will also tell you that what all things you need to do and what all things you need to avoid, especially during the first trimester of your pregnancy. So the do's is that you eat a lot of fruits and vegetables. There are no contraindications or no fruits which we say that you should avoid. All the vegetables should be taken and they should be thoroughly cooked and thoroughly washed so that you avoid all the different kind of infections which can come from raw fruits and vegetables. Do daily exercises and also ask the doctor that what all things you need to avoid. The things which you need to avoid are no smoking, no alcohol, no recreational drugs, and also, especially during the first 3 months, avoid having sexual intercourse with your partner. So these are the do's and don'ts which are very important and which should be taken care during the first 3 months. Also, the doctor would like to get a dating scan done, which will be done especially when your pregnancy test has come out to be positive. They will do the scan to know where is the site of pregnancy, where the pregnancy is located, whether the pregnancy is healthy or not, and what is the actual date of your delivery. So all these things we'll get to know from the first trimester ultrasound, which we'll get it done as soon as the pregnancy test comes out to be positive. Then the doctor will also warn you about the symptoms which you can experience during the first 3 months. The symptoms can range from excessive nausea and vomiting during the pregnancy. That can happen during the morning time, or the nausea vomiting can happen during the evening time, or it can happen throughout the day, or some people do not have any kind of nausea and vomiting. So all of these are normal to happen. But anything which is excessive nausea and vomiting, which is causing dehydration, which is letting you to not able to get out from the bed and affecting your day-to-day activity, that is when you need to again consult your gynecologist and get you started on all sorts of medications which will prevent nausea and vomiting. Then you might have excessive frequency of going to urine, and this can happen because the uterus is growing because of the pregnancy. That is going to put the pressure on the bladder and hence increase the frequency of you rushing to the washrooms. Then you might also experience soreness in the breast. You might experience lethargy, body aches in the whole body, legs, cramps. These are the few things which you might experience. The doctor will warn you and will give you the adequate medication which is required, which you can take for all these symptoms. These are the few things which the doctor will tell you during the first visit. They will also get your basic blood test done to know is everything is under control or not. That is why it is very important that as soon as your pregnancy test comes out to be positive, you visit your nearby gynecologist so that they can warn you, they can tell you, they can advise you of all the things which need to be done during the first 3 months of pregnancy. Thank you.